As usual, this presentation will run as a slideshow. If I think there needs to be clarification on a particular point or fact, then there will be an audio. Otherwise, just let the PowerPoint run. If you'd like to stop it so that you can take notes, that's perfectly fine. It will start again. Thank you. If we were to list all possible emergencies we need to respond to, the list would be endless. And that's not the goal of this presentation. This slide in particular suggests that we consider a range of events and what we would do as responsible responders. Your on-campus skill training will cover different emergencies and your response to them in much more depth. Every critical environment facility should have an emergency plan, which covers the resources, equipment, maybe specific procedures, and evacuation routes. This has been created by the biosafety officer and a team of individuals in the facility. You should be aware of the basics of such a plan if you're going to do regular work in a facility. So, think back to your list of possible emergent events. You should be asking, what might the hazards be in this case? Who is responsible for cleaning up contamination? Who provides medical treatment? Are you responsible for that? Do you call someone in? A good emergency plan should answer all of these questions. It's so easy to pass by the emergency exit route diagrams that are posted everywhere in all buildings. Make it your job to notice and to quickly think through the exit route you'd need in an emergency. Also, there should be some type of location designation of emergency equipment posted. You may or may not be trained on all emergency equipment in a facility, but take the initiative and know how to use at least a fire extinguisher and AED. Misusing equipment in an emergency can be as harmful as not using it at all. This is a short list of items you should absolutely have available in a facility. On the next slide are a couple pictures of items you might need. Do you know how to use these things? Do you know how to correctly use them and when? This slide brings up a good point. In an emergency, you need to know where to find the responsible person, possibly their phone number. But more importantly, I think you need to know who that person is, because you're not responsible and really should not call the fire department unless that is a designation or a responsibility they've given you. You shouldn't be the person calling for emergency medical help, nor should you be giving it unless they have designated you as such. So, back to the slide, it's important to know who the responsible people are. Generally, it's going to be the biosafety officer. Now, I just said generally, a biosafety officer is going to be the responsible person you want to find in an emergency, but in a large emergency, there are going to be many people responsible for different tasks. And so I'm just going to cover them quickly here. There should be an incident commander. He or she will coordinate all the activities. There should be a public information officer, someone who is primarily responsible for communicating with the public and communicating the logistics of management. Of course, there will still be a biosafety officer. I know I just said that in an emergency, you should contact the biosafety officer. They will be the person responsible. But in a large emergency, of course, there are going to need to be many responsible individuals taking care of different aspects of the remedy. There would be an incident commander who coordinates all of the activities. There would be a public information officer. And so this is important to you because that public information officer is the only person who ought to be talking with the public. Not you, not the scientist, just the information officer. There is a logistics person, of course, and there is the safety officer who represents all of the scientific risk, what's going on in the laboratories. That's slightly different than the person who's responsible for operations and maintenance, who would be representing the mechanical risk. Thinking through what you would do in an emergency is a lot like hearing the flight attendant tell you to put on your oxygen mask before you help someone else. Always be certain that you're okay. And then check the scene. Is the area safe to go into? What happened? Are there victims? Are there other victims? How many other victims are there? Do they need medical help? Don't offer medical help that you're not trained to give. Don't panic, or rather I should say, try not to panic. Send for help. Consider, can you handle this by yourself? Do you need a respirator? Think through the possibilities before just rushing in, which honestly is the response of everybody. This isn't a checklist for emergencies, but should help you begin to develop an awareness of your options. You should call for medical help if there is a victim who is unconscious. In a serious medical emergency, it doesn't have to be a facility collapse for someone to have a heart attack. That's what's being spoken of here, or their broken bones. If you need to help them to an exit, you need to consider that there's going to likely be a shower room or an anteroom, and that would be a safe place to take them. However, you might also need to consider that they were in isolation of some sort. So, to help assist a person to an exit or all the way out of the building is going to require some skill. And you will learn those skills in your on-campus training. Once you've done anything, though, report what you've done to the supervisor, to the biosafety officer. Again, this is just a short list of common emergencies in a critical environment facility. The following slides will help us consider some of the questions and answers that you need to be effective in these situations. Consider the difference between an office fire, which would be bad enough, and a fire that begins in a laboratory containing chemicals, pressured gases. Ugh. Consider the difference between an office fire, which would be bad enough, and a fire that begins in a laboratory, which might contain chemicals, pressurized gases, unique ventilation. Suddenly, a safety plan becomes important, doesn't it? Your facility, or the one you're in, will have specific plans for many of these events and will train you annually on how to address them. You remember that a BSL-3 lab has signage on the exterior of the room that mentions what's being done inside, what organisms are being used, and of course gases and other hazards are posted on the exterior of the room. And when you think about a fire being in that room, suddenly that signage becomes important because you want to be sure to use the right fire extinguisher. Do you regularly review which extinguisher to use for what kind of fire? Barrier integrity refers to airflow issues in labs. So when the lab barriers, like walls and doors, allow lab air into the main facility, that's called loss of barrier integrity. Loss of that integrity creates an issue where contaminants are spreading through the entire building. If this happens, be certain you stay safe while correcting the problem. In other words, you may need a respirator. You may need different PPE. Follow the safety procedure. They'll be posted outside the lab. Alert others. After entering the lab, close the sash. Pull down the sash on the biosafety cabinet to prevent even more contaminant from leaving the area. That's what is called containing biological agents. Undoubtedly, your OSHA training has prepared you to clean up many different types of spills, and that's good. But in a critical environment facility, pay attention to when to exit, because some of these contaminants should be isolated and cleaned later by professionals. You'll learn much more about this during your on-campus training and the Introduction to Decontamination unit. Think about the specifics of a spill. Where will it come in contact with you? Do you need a respirator? Do you need different PPE? Of course you know this, but have you thought about what kind of gloves are necessary for different types of chemicals if they spill? The biosafety officer would of course have these gloves available, but that makes them the person to go to should you come upon a chemical spill. You're not likely going to be the person responsible for cleaning up a biological spill, so this slide is more FYI, just so that you understand what has to happen before the room or the area is safe again. Let's talk just for a second about types of chemical burns. I know that sounds horrible, but there's a difference between being burned with an acidic chemical and being burned with an alkaline or a basic chemical. An acidic chemical will burn you immediately. You'll immediately feel burning sensation. But a basic chemical like lye will penetrate your skin and burn deeper layers of tissue. So really, you need to know what you're cleaning up before you start. You need to be aware of what different type of PPE you may need. Also, be aware of fumes. If something gets in your eyes, you have about 10 seconds to begin to flush them prior to damage. So immediately look for the eye wash. Flush them for 15 minutes. I mean, that will seem like forever, but flush your eyes for 15 minutes. Water running over your eyes. If there isn't an eye wash, use a shower. If there isn't either of those, put your head under a faucet because honestly, your vision is at stake. If you find that something has gotten on you, gotten on your arm or your face, your neck, it's going to be hard to decontaminate it like you should, because generally we just think we'll wipe that off and go on. But you really do need to flush it immediately for 15 minutes. Because remember, there are chemicals that you'll feel. You'll feel their burning sensation, but there are others that we don't feel. They penetrate. And there are biological hazards which are absorbed by our skin. So if something gets on you, just wash it off. This slide addresses the unfortunate situation of finding a suspicious package. If you do, the thing that needs to happen is that it needs to be isolated. The leakage needs to be prevented. So if you have something to set over it or around it, a plastic bag even, put it in an area that is isolated. If you can close a door on a room and walk out, do that. Possibly leave some sort of signage. This slide addresses the unfortunate situation of finding an unattended, suspicious package. If that is the case, the thing that needs to happen is it needs to be isolated. It could be put in a plastic bag. It could be, you could put a trash can over it. You could close a door and leave signage, but it needs to be isolated. Don't smell or shake it. Just isolate it, leave the room, close the door. Wash your hands and any exposed skin. Be sure to report this immediately to a supervisor and the biosafety officer. And list all of the people in the area when you found it, because they will need to be checked out as well.